Hi, and welcome to a webinar from Delta Omega, the Alpha Nu chapter of Delta Omega. This is the National Public Health Honorary Society. We're based in Arizona, and today's guest speaker is Gita Mishkin. Gita will discuss her work as Principal Brand Analyst at Symphony Health, where she utilizes data to help pharmaceutical companies make better decisions on their post-launch marketing strategies and product development. She's an alumna of U of A, earned her Master of Public Health degree in 2007 with a focus in biostatistics, much smarter than me. Upon graduation, she began working for the Arizona Department of Health Services in Phoenix, where she held positions within the Bureau of Women's and Children's Health and the Bureau of Tobacco and Chronic Disease. And you can connect with her on LinkedIn. Today, we're going to talk about her current work, her career trajectory, what she's learned so far, and then we can have some discussion and question and answer after her remarks. So Gita, thank you very much for being on, and the floor is all yours.
Oh yeah, sure. So hi, I'm Gita Mishkin. I am, as John mentioned, currently my role is with an organization called Symphony Health Solutions as a principal consultant on what we refer to as our brand analytics team. When I first graduated from the U of A with my master's in biostats, I actually went the traditional route of going straight to the Department of Health Services. And I was there for about 3 years for the Bureau of Chronic Disease and Tobacco. But I just reached a point where I felt like I wanted to try and do something a little bit different with data a little bit more differently. So I pursued a position at Symphony Health, and at the time it was called Wolters Kluwer. We've gone through a couple different iterations of names as per typical for private companies, but I did end up moving from kind of the public health space or the public space into the private space. I'm still working really closely with healthcare data. So what I do currently, I've been with Symphony now for about 10 years. For 2 years, I did a brief hiatus and went and worked for Humana, the health plan, in their health economics and outcomes research group. So I've sort of just been spending a lot of time exploring the different types of data within our industry. As a principal at Symphony Health, what that means, and a principal for the brand analytics team, is what that means is I'm essentially a subject matter expert on patient level data. And we collect healthcare claims that are processed in the industry as they are aligned through physicians, medical offices, hospitals, and patients. Everything we have is de-identified. So essentially we put everything into this really large data set, and we speak with different pharmaceutical companies to make sure that we are using our huge data asset to help answer their specific questions. Some of the types of questions that we might get are things either from the health economics and outcomes research side, where they are trying to understand specific disease states, whether it's rare disease or oncology, anything like that. And we use our data to help them understand what's going on in their space. The other things that we might do are to help them understand increases in the number of prescriptions that are being written for their products when they launch them, where should they launch them, how should they launch it, and all of those different types of decisions that are being made by these pharmaceutical companies. I spent a lot of time working at the beginning with some of the government agencies as well, in terms of helping them understand whether or not pharmaceutical companies were in compliance with indications, or help them understand whether or not another indication could be added to a specific product. So currently, as an example, we are obviously rapidly tracking what's going on in real time associated with the COVID-19 and how that's impacting pharmaceutical sales, how it's impacting patient behavior and filling their prescriptions, and including how are they going to doctors and visiting physicians? Are they transitioning more towards telemedicine versus something else? as a principal, so that's kind of Symphony in a nutshell, but as a principal, what I do is I made the decision to go from being a coder, or the person that gets my hands kind of dirty in the data, to being more of like a methodologist and coming up with the business rules or the methodology to help answer the questions for the clients. I spend a lot of time meeting with my clients, with my specific pharmaceutical companies, and kind of talking through what it is that they need to get from our data in terms of whether it's another subset of data, a specific analysis driven by our data, all that type of stuff. How can they augment it to make sure that they are making the best decisions they can for their product? So yeah, that's pretty much what I do.
Thank you very much. If people have questions, you can go ahead and type it in the chat area, but we'll open it up to audio in just a minute. I want to ask you, are a lot of the decisions driven by the pharmaceutical companies, the clients of Symphony Health, required by the FDA anyway? Are they just fulfilling what's required by the government, or is it internal discussions about business development and sales that is outside of the requirements?
So we focus mostly on phase 4 post-marketing information. So it's not always driven by the FDA. The FDA might ask a pharmaceutical company, you know, is there something that's being used off-label, or if there's an adverse event, it needs to be reported, stuff like that. But that's not really what my organization manages. We are part of a larger corporation called PRA Health Sciences, and they do a lot of the clinical research in terms of bringing products from the initial molecule and bringing them through the different phases of market level approval. But, you know, we might encounter a pharmaceutical company asking us to look in our data in the cases of, you know, whether or not they want to add another indication. There's some products out there like Humira, if you've ever seen an advertisement for those for rheumatoid arthritis, it has so many different indications. So, you know, the FDA, just as an example, like it's not my client, so I don't really know if this is a true question that they've asked, to be honest, but they might ask us like, hey, we know that Humira is used for rheumatoid arthritis. Can you tell us whether or not there are patients that are also diagnosed with, I don't know, COVID-19? And can we use Humira to treat COVID-19?
Wow, okay.
So you can, yeah, kind of look at that.
So that could also apply to the controversy going on right now with hydroxychloroquine, and people who come up with those drugs wondering, can it be, what are the data that indicate before we request usage off-label? What are the data to indicate internally they want to know before they talk to anyone else or ask for approval?
Right, yeah. So in those cases, you can really just kind of start to understand what's going on with the specific disease state. COVID-19 has a lot of different ICD-10 codes right now, what we refer to as diagnosis codes in the industry. And basically what that means is when a patient goes to a physician's office and they are speaking to the physician about any types of the treatment, they will be assigned a specific diagnosis code to that treatment. There's diagnosis codes for everything: Alzheimer's, hypertension. The funny one that I just saw was like exposure to a rat bite. So they're very specific. But so what you could do is you could kind of take a look at those specific diagnosis codes and see whether or not there's an increase in the patients that have some of the comorbid conditions that go along with the COVID-19, hyperventilation, oxygenation, I can't say that, sorry. And then also you can look at whether or not they are taking hydrochloroquine to see whether or not that would help them at all. At the end of the day, whenever a pharmaceutical company is looking to prescribe a product or they're looking to drive a product as a treatment for something, they need to have FDA approval. I believe the FDA has been kind of granting compassionate care utilization to all of the to a whole bunch of different hospitals to be able to use some of these products. But yeah, that's one of the ways to measure it.
Okay, great. Thanks, Gita. So there's a question that came in that was written in, what advice would you have for graduating MPH students who are looking to get into this line of work? A lot of members are starting the job hunting process and would appreciate your advice.
Yeah, sure. So I think it just kind of depends. I think when you traditionally come out of your MPH, the gut reaction is to kind of go towards the government, to go work at one of the health departments of health services or education or NIH, CDC, these types of things. I think those are really great baselines to start working. They really give you an opportunity to kind of get to know the industry, know what you want to do with your career and everything. And then if you are looking to kind of get into clinical research or pharmaceutical data or healthcare data, I mean, it's a matter of just looking up those kind of specific companies. You can even look at the pharmaceutical companies to see things like the positions that I normally see posted are things like business analyst or research analyst. Some of these organizations do have epidemiology positions open. The other things you could look for in terms of job descriptions might be looking in the health economics and outcomes research group. That's where in pharmaceutical companies or in like even in my organization, those are going to be or like medical informatics, those types of things. Those are going to be where you actually find a lot of us. You find a lot of MPHers with either a statistics or a epidemiology background.
Great. There's another question that came in. Do you use any of these data analytics tools to measure prescribing patterns of antibiotics or to help to map the spread of antimicrobial resistance, or is that outside of the scope of Symphony Health and your current clients?
So that is something that we can do. There are different ways that you can do that in the data to measure prescribing patterns. So like if a client came to me and asked me this question, right, my answer would be, all right, let's take a look at all of the patients that are prescribed an antibiotic, and then let's look in their history for specific types and this is where, so just as an example, this is sort of where like the subject matter expertise and where the utilization of having that biostats or epidemiology background really comes in handy, because you have to understand how disease progresses. And so if a client approached me and asked me this question, which they do, they ask questions like this all the time, I would say, okay, let's take a look at all of the specific antibiotics you're looking for. So maybe you're interested in azithromycin. So you pull all of the patients, physicians that have azithromycin in their history, and then you start looking at the patients and you start seeing how frequently are they prescribed azithromax. Do they transition from azithro to something else? Maybe they stop using azithromax because they start using something else. And then you can also start linking in their medical data and their diagnosis information to see, do they have a diagnosis code for resistance, antibiotic resistance, or do they have anaphylactic shock? Do they have, you know, a repetitive diagnosis maybe for strep throat 3 times in a row or something like that. And these would be the different types of business rules you would talk to your client about, and then your analyst, and kind of start fleshing out specifically what that would look like.
Okay, great.
So, yeah.
So the sources of data really makes a difference. Where do you have to get electronic health record access from all doctors in, let's take Maricopa County or Arizona? Or is there a database that you tap into that just sucks up all the information and you query that database?
Yeah, so at our core, Symphony Health, we actually are data aggregators. So we work with a lot of the different data kind of vendors, I guess would be the best way to say it, in our space. What that means is we take a look at contracting with specific pharmacies, specific claims processors, and, you know, maybe large medical chains, stuff like that. And what we do is we receive all of their information. Now, because of HIPAA and because of what we do, everything we do comes from, every vendor sends all of their information through a third-party de-identification system. And then by the time it comes to the Symphony Health walls, it's already de-identified. So we might know that Gita Mishkin is a female that lives in Phoenix, Arizona, and is, in her 30s. But then we would not know that I am Gita. We would not know that that number, that token, that patient ID is actually Gita Mishkin. We would just be able to say, here's her demographic information, and here is the information associated with them. Now, what that does, though, because we require all our vendors to kind of send their data through a HIPAA-compliant de-identification process, we are still able to get one token. So we would know that that Gita Mishkin equals 1, 2, 3, 4. We don't know Gita Mishkin equals 1, 2, 3, 4, but we see 1, 2, 3, 4 has these prescriptions, has these diagnoses, has these procedures. And then we even contract with electronic health records to look at medical records and stuff like that.
Okay, great. Excuse me. There's a question from another longtime listener, first-time caller. Do you integrate other data sets, such as claims data and social determinants of health and other population-based data as well?
Yeah, so we are claims data. So yeah, we integrate all sorts of claims data. That's what it is at our heart. We take, so prescription claims are NCPDP forms, and then the hospital and medical claims are the CMS 1400 and 1500 claims that are actually submitted by the hospitals and medical offices. So all the information that's gathered on there is all the information that we gather. We don't usually integrate a lot of the population health data or any of the other health departments and stuff like that, because those do not have identifiable patient information that can come through our de-identification, be put into our data. We use it to help kind of we use population data and stuff like that to help create our denominators if we're trying to measure disease incidence or prevalence, but we don't directly link it to, again, that patient 1, 2, 3, 4, 5. And then the other reason we don't do that is because it's just not, again, like our main focus is to make sure that we are HIPAA compliant, and you cannot re-identify a patient. Like, even if we have an analysis or a data set that we are worried that somebody might try and do that, it goes through another privacy review to make sure that that is not possible. So we're very vigilant about how we do it, but we have access to a lot of information.
Do you feel like your job is big data analysis, and has it been growing since you've been in Symphony? Is it, are clients asking for more and more? Are there more companies involved? Are they asking more and more questions?
Yeah, so big data in the healthcare space has always been a huge thing. And, if you are in your MPH programs, or you are in an organization and you're really interested in trying to be part of kind of the big data world, because that's where your heart is, this is kind of the same, the place that you want to be, right? Because so that was what happened with me, where I prefer understanding data. I prefer to understand data. I prefer to create the methodology for manipulation. I don't want to actually be doing the coding, but I am able to design the data sets and stuff like that and manipulate big data. And when I went to Humana, it was a much smaller data set. They are not a data integrator, and I missed it. And that was why I went back to Symphony. So it's just a matter of kind of determining what data you like and what data you want to work. I know that sounds really nerdy, but what data you like working with to kind of decide what organization is the organization for you.
Yeah, it's pretty clear that at the core you're still a data geek, I guess, and you want to see the numbers and analyze things. Well, thank you for all your comments so far. I want to see if there are any other questions from the attendees. Okay, well, hearing none, thank you very much for your time. This has been a presentation of Delta Omega, and our guest speaker today is Gita Mishkin, who graduated from U of A with her Master of Public Health degree in 2007, focused on biostatistics. And now she's the Principal Brand Analyst at Symphony Health. So please connect with her on LinkedIn and come back for another webinar from Delta Omega, the Alpha Nu chapter. Thanks, Gita.
Thanks. Bye.